air pollution, one of the worst in the world and discussed and debated come every winter in India. But this time, it could cost you more than your health. Indian insurers are considering increasing health insurance premiums for Delhi residents by 10 to 15% due to a surge in pollution-related claims in 2024. Now, Delhi experienced some record-breaking air pollution in 2024, leading to sharp increases in hospital admissions for respiratory and cardiovascular conditions like asthma and COPD. How will these proposed premium hikes impact Delhi residents' affordability of health insurance? Does this mean that other cities will also follow suit? So to understand this and get some more perspective, let me go over to my guest this evening. I have Siddharth Singhal, Business Head, Health Insurance, PolicyBazaar.com, and Dr. Preetpal Kaur, Senior Consultant, Pulmonology at Apollo Spectra. Siddharth, I'm going to come over to you. Before we jump into all of this, set some context. What are insurers proposing and why?
So I think, first of all, thank you, Sanjana, for having me on the show. See, I think, one of the thought, and in fact, it's a very at a conceptualization stage, it's not final, is does air pollution really play a role in terms of higher claims payout, be it in terms of the frequency of claims, that is, you need more hospitalization because of because of the pollution. That is one. And does it lead to a higher severity, which means do you need longer period of hospitalization? So I think one of the concepts being mulled over is whether does that actually play a role in terms of the claim payout. So I think it's at a very evolving, very initial stage right now, which the insurers are thinking. Whether and when does it see the light of the day, I think it's still to be figured out. But yes, I think that's a thought right now.
All right. So if I were to ask you, Dr. Preetpal, give us a sense of the number and propensity of cases that you have been seeing, particularly in 2024, because last year it got really bad in the national capital.
Exactly, because Delhi is now becoming a chamber of gas. Everybody knows very well. The patients rising now 10 to 15% in respiratory health diseases specifically, and they remain in ICU long term, sometimes 10 to 15 days, no doubt, and their illness is increasing day by day. Their health is even decreasing day by day. Most common diseases are like even anxiety disorders, sinusitis, chest problems, and some patients who are old age specifically, when they just come to exposure this pollution, they come into a COPD, severe COPD, and they went on ventilators, and even more this cardiac diseases also, and lead to deaths sometimes.
So, Siddharth, then how will this increase in these premiums, even if it's proposed, okay? How will it affect the middle-class families in Delhi, the affordability, and Dr. Preetpal, maybe you can weigh in on the healthcare access. But Siddharth, how is it going to affect?
Sure. So I think, like I said, Sanjana, this is right now a proposal. It's a thought right now. So we'll see whether one, the regulator also approves it or not. Whether how it goes forward. As we move ahead. See, I think that is one part of it because it's still to be seen. The second part in terms of affordability, obviously, the premiums do rise. Basis the cost of hospitalization, but I think. Currently, also there's been a lot of product innovation because of which even though the premiums have gone up, the cost of insurance hasn't gone up much. In fact, the average ticket size last year versus this year is almost similar. And I'll tell you the reason why. Because product innovation is that answer, which is basically enabling customers to get a lot of discounts on their health insurance premium. Just to quote maybe 2-3 examples. For example, one, insurance plans have become a lot more modular right now. So you can add features, you can delete features and get discounts against it. If you choose to go to a preferred network hospital of the insurance company, you can get up to 15% discount. If you can lower the room category, which was not possible earlier too much. Now you can get up to 25 to 30% discount if you opt to go for a general ward. So I think the product innovation is the answer going forward. Even let's say the cost of hospitalization is something that will keep on going as per the medical inflation, but the product innovation by the insurance companies is something that will keep making health insurance affordable, and I think that's the objective of everybody.
One more question before I come to you, Dr. Preetpal. Give us a sense of what the insurance currently covers when it comes to pollution, or if this goes through, if the regulator actually approves this premium, is it going to be the first ever addition under these increased premiums that will cover air pollution solely? Because my understanding is that it covers pollution-related diseases, but nothing specifically with air pollution. Can you clear that out for me?
Yeah. So absolutely right. So right now, the health insurance cover any kind of an inpatient hospitalization and also outpatient OPD expenses as well in some cases. So largely that inpatient hospitalization could be due to any reason. It could be, let's say, due to let's say cardiac ailments. It could be due to COPD, respiratory ailments, which may or may not have been directly linked to air pollution. So that's why I said there's a lot of empirical evidence which might be required to prove to the regulator as well that whether actually air pollution has caused a higher claims. So largely this is covered by the health insurance plans right now.
Right, Siddharth. And Dr. Preetpal, if I were to ask you, give us a sense of, I know this is something that is constantly discussed, especially around the winter time in the national capital. But what does the kind of long-term exposure mean for the residents of Delhi? Because it's not just, 1 year, or it's not just a couple of days in the year. This is sustained, relentless, continuous exposure to bad, toxic air for these amount of months every year.
Exactly. In mean to say, we always divide the respiratory diseases like acute and chronic. Acute means less than 6 weeks, like whenever there is a weather season, specifically winter season. This lead to acute conditions like those patients who are allergic to pollutions. These problems like asthma, sinusitis, these are acute conditions. But what is COPD basically and cardiac diseases? If patient is having continuously exposure more than even 5 years, that lead to this chronic obstructive pulmonary disease, but in layman language is a COPD. More than 5 years is more important. Not this COPD, what we are asking. There are other diseases also. That is called interstitial lung disease. In layman language, it's a shrinkage of lungs. That is more dangerous even than COPD because patients are not able to breathe even themselves, I mean, not even with oxygen levels. We will ask about only pollution. Pollution is not related to only our vehicles and this stubble burning. Even our other things also like air, dust, and there are so many reasons of this combustion of pollution, this vehicle emissions products. These lead to a permanent damage of the lungs slowly. That is called basically interstitial lung disease, which is more dangerous even than COPD also.
Preetpal, if I were to ask you, what are the kind of challenges that your patients face when it comes to insurance and getting the claims when it is to do with air pollution? Because we're seeing obviously so many more claims being filed, especially in 2024. Are you getting wind of what the patients' challenges are?
Exactly. Whenever we mention COPD, I already told you COPD is a chronic disease, no doubt. It happened even after 5 years if there is a continuous exposure. Now, if patient is a smoker, suppose it's an active smoker, that is also cause a COPD. And other thing, even a passive smoking lead to a COPD. And this insurance people, whenever we mention COPD, they always think it's a active smoking something lead to COPD, though it's not there. So they have always challenged these things. If this means COPD, patients suffering from COPD, it's not related to only pollution, that means also related to smoking also. Though, if you will see, only in India right now, 70 to 80% are those smoking, but in Delhi especially, if we will see 20 to 30% people are not smoking. They are exposing to a passive smoking that lead to this chronic obstructive pulmonary disease. Another ILD, what I was talking again is a chronic disease. It is a persistent exposure of the pollution. Again, it will mention in the policy it's ILD or COPD in view of this insurance people. They always think it's not related to something related to only pollution. It's related to patients on drug addiction and smoking. That's a big challenge in our hospital, specifically whenever we mention all these things.
Thank you, Dr. Preetpal. And Siddharth, my last question to you before I thank both of my guests for joining me this evening. We understand that, of course, like I said, we always talk about the national capital, but Mumbai isn't too far behind, Kolkata isn't too far behind. Bengaluru also has its fair share of toxic air and air pollution to report about. What if other cities start following suit? And I know that, this is a proposal and nothing yet has come through, but what is the kind of premium that is being proposed? What is the kind of premium that we're looking at on these health insurances?
So I think, as you rightly put, it's not a Delhi specific problem. It's largely a North India, dominantly North India problem. And then obviously, other cities are also kind of, falling to air pollution. So obviously, I think it's a national, I would say, is a cause of concern that obviously needs to be sought by a multiple stakeholder. But as far as I think, if let's say it makes at a national level, the claims go up, then automatically the premiums have to kind of follow the suit in terms of what the claim payout are. But like I mentioned, this is still a lot of contemplation right now, because there is no empirical evidence right now correlating the claims to air pollution only, because obviously during these seasons there's a dengue also, there's a lot of cardiac ailments as well, brain ailments which have come to much younger people right now. So I think it's still a lot of work in progress when it finally comes to fruition, if at all it comes to fruition. So I think that is to be seen. Secondly, I think what also has happened, which I maybe forgot to mention earlier, in fact, a lot of health insurance plans now offer, day 31st cover, basically right after you serve the 30 days waiting period. So in fact, earlier the waiting period for diseases like asthma and COPD were mandatory 3 years or 4 years. Now, a lot of insurance companies also offer the customers an option to reduce that waiting period from 3 years to 31 days. I think that's a positive development, wherein basically insurers have also recognized, because given the pollution, asthma, COPD is becoming a lot more common now, and I think there's a need for addressing that problem in a very fruitful manner.
Absolutely, Siddharth and Dr. Preetpal Kaur, thank you so much for joining me this evening. Clean air in Delhi, you better insure yourself, because we're still waiting for the proposal to come through. But if so, the premiums on health insurance because of air pollution now will increase. Thank you so much.